Hi everyone, Dr. Breiner back here. We had a little technical difficulty. Hopefully people can hear me now. So I am going to just start our broadcast anew. So this is our second installment about Lyme disease, a whole body approach. And we're going to be talking today about our next topic, dealing with Lyme disease. Okay, so again, here's the outline. I'm just going to show you here on the screen so you can see what we're going to be talking about. So number one, we talked already last time about what is Lyme disease and the clinical signs and symptoms. We talked about, today we're going to be focusing on the conventional testing and treatments. And then we're going to talk about a whole body approach. All right, conventional testing treatments today, and our whole body approach being things like EAV testing, removing the obstacles to cure, homeopathy, botanical medicines, aiding in detox, and alternative antimicrobial therapies, and things such as hyperbaric. So we'll get into that, and I'm sure you'll find it all very interesting. So the cause, again, the spirochete, Borrelia burgdorferi. There's a refresher for you, the little spiral-shaped bacteria. We have the Ixodes scapularis, which is the tick that can transmit Lyme disease. Springtime, a big time that you can have an increase in the amount of ticks out there, an increase in Lyme disease. And again, it could be in almost all the ticks or some of them, depending where you live. If you want more information, again, go back to the last video and you can understand what I'm talking about. We'll also have them on our YouTube channel, so make sure you go there. And there's the tick, really nasty. They can be really small, like that one on the far right here on the left. You see that little guy? Well, he is a nymph. He's a baby Lyme tick, and or deer tick, shall I say, carries Lyme, and just as much as the big guy over here, just its older brother. They bury themselves into your skin and suck your blood and transmit nasty diseases. A few days or months later, you're having things like flu-like symptoms, fatigue, muscle aches. You can have nervous system issues, memory issues, cognitive issues. The list goes on and on. Again, we went over that a lot more last time, but it's known as the great imitator because it can imitate almost any disease and crawl across any field of medicine, all the ologists, right? So it could be their jaw, it could be in the bladder. So, right, we have dentists, we have urologists, the lung, pulmonologists, ears, ENT, eyes, optometrists, ophthalmologists, throats, stomach, heart, cardiologists. The list goes on and on. Psychiatric symptoms. So it really can be almost anywhere and almost anything. So, but today we're going to talk about testing and what testing can be done, because this is very important to understand how testing is done, or in some cases is not done well for cases of Lyme disease. Now, there's a few different types of tests. The first one done according to the CDC is something called an ELISA test. Okay, the person has this positive ELISA test, which is not a very great test to do, but it is the way the standard medical community does its first tier of testing. It's called an ELISA test. If it comes back positive, then you move on to the next test, which is called a Western Blot. If it's negative, well, then that's it. Maybe it's something else. But hopefully the doctor is using their clinical judgment to think, what else could it be? So Western blots are a test that would be what we would consider to be the next tier, okay? And what they're doing is they're taking the blood sample, and we're looking to see if you're creating antibodies against the spirochete, against Borrelia burgdorferi. You can also be looking at Western blots for other infections, too, that can occur with Lyme disease, like Bartonella, or Ehrlichia, Anaplasma, et cetera, Rickettsia. These are all tick-borne diseases and can be co-infections. And what happens is people are looking at, do you have IgG, IgM? Okay, IgG, IgM. Oh, my doctor said I had the infection in the past. I don't have it now. Or I have band 41 positive. I had 2 bands positive. I had 3 negative. And people don't even understand what the heck a band is. I mean, what's a band? It's not a rock and roll band. It's actually very specific because it determines how much reactivity you're having against a part of the cell wall of the bacteria. Remember the bacteria we just saw again before? It's that spirochete. It's that looks like a corkscrew. But there's different proteins on the cell wall of the bacteria, and your body makes antibodies. The immune system tags those different parts of the cell wall in order to create an immune response and attack them and kill them and get rid of them. So what they do is you take your blood and they put it, they're tagging the antibodies and they're trying to see, well, how much do you have or do you have them at all? And what they do is they put them on a sample, and this is a well here. So you're kind of getting a sense that we have these different samples. Say 1, 2, 3, 4, 5, 6, 7 are different patients. Number 8 is the control. Okay, and what they're doing is they're putting the sample in one side, and they use electrical charge, positive and negative, right? Negative things get attracted to positive, vice versa. And as the time moves on, different complexes here, the antibody, antigen, will move down, and according to their weight, will either go further or not as far. And again, according to their weight. So if we want to look and see band 41, this number 41, look at that. Besides, it says KDA. That stands for kilodaltons, which is a very small weight measure. Okay, so you could say kilograms if you want. Use whatever, pounds. Okay, so 41 kilograms, 39 kilograms, 34. So the complex, that immune complex at 34 pounds is found, that's what it looks like. Okay, so that's just one way to think of it. Right here, number 7, this well here, this is, let's say, another patient we took, this is amazing. Let's say number 7 is Jane. Okay, we take Jane, take her blood sample, and now it's going along, and this settles over here at 41 kilodaltons, and you can see how it's kind of light. Does she have that or doesn't? I don't know, okay? 39, oh, she definitely has that. 31, she definitely has that, and nothing else. So she would be positive for band 34, positive for band 31, and depending on the lab, they may not look at that too well, and they may say, she's negative for 41 too. Some labs, some better labs we'll discuss in a moment, may say, oh, no, she's slightly positive. Now, vice versa, go over to our next few patients, like, here, patient number 2, Joe. Well, he's got, maybe band 84, I don't know. He definitely has band 33. He's got some other bands here, like 41, 39, and band 22. Okay, so what they're looking at is they're trying to say, well, how many of these bands are showing up? Are they positive or are they negative? And standard labs, Quest, LabCorp, others, are using these standard kits that the CDC says, okay, these are the bands you look for. And some of them are not looking at enough of the cell wall of the bacteria, so they're missing things. Number 2 is you can already see that it's hard to always pick up on those bands. Sometimes the bands are very clear, and sometimes they aren't as clear. So that takes judgment on the technician's part. And so we want to use labs that actually have technicians who know what to look for and are dealing with tick-borne diseases all the time. And I'll explain about some of those in a moment. But you also have something called IgG and IgM. Okay, when your immune system first makes and attacks bacteria or viruses, you have our body going in and just dealing with it right away. And then it starts developing antibodies over time. The first series of antibodies are called IgM, immunoglobulin M. And then as time goes on, IgG rises. It's like the memory immunoglobulin. So, I remember that infection I had like 5 years ago. I still got antibodies hanging around just in case it comes back. That's your IgG. But life isn't as simple as that, because sometimes you could be very positive IgG. Some doctors will say, well, you had a past infection. You don't currently have it because you're not showing IgM. Does it mean they don't have the infection currently? By basic ideas of immunology, you would think so, but it's not always that way. So again, Western Blot can be good if it's done by a good lab, if they're looking at enough of those antibodies and antigens complexes, and if they're actually seeing it properly. So they have good technicians. So looking at the correct number of bands or correct number of parts of the cell wall, and you have to also think that your body has to make the immune complexes. It has to create the antibodies to be picked up. So that's part of it. Now, let's go over to this next slide here. But there are better labs out there. There are better labs that are specialized in tick-borne diseases, such as Igenix Lab in Palo Alto, California. They're a really good lab. They actually know what to look for. They look at more of those parts of the cell wall, which are more specific for things like Borrelia. So they know, okay, if they're coming up positive there, that's one way to do it. There is other testing available that they do and others do. It's called PCR, or polymerase chain reaction. Basically, it's DNA. If you find the DNA, I caught the guy. I got his DNA. So now that's a definite proof positive that you have Lyme disease. So that's another way of testing for Lyme. I'm not really going into all the testing methods. I just want to highlight a few because I think the Western Blot is very important for people to understand because there's a lot of misconception about it. Hopefully you understand a little more if we just went over it. Again, there's DNA testing, PCR. But even with Igenix like that, them doing their Western Blot, it may not come up positive. And sometimes you do get samples and you send it for DNA. That doesn't come up positive. Why? Because you might not have the bacteria in the sample. Therefore, you won't get a positive DNA. That's one art. Armin Labs is the labs we use a lot here. It's in my clinic. They're in Germany. They're an internationally accredited lab, and they have some more sophisticated tests. I don't know, but they're just doing things a little bit more rapidly and I guess better right now in Europe. And they have tests like EliSpot testing, CD57 testing, which we'll go over in a moment. Igenix does have that available, and even some of the conventional labs here have that available too. But they're just looking at it a little bit better, I believe, at Armin Labs. TickPlex, which is another type of immunobody test, and SeraSpot, which is a better, newer type of blot test, like a Western blot, but it's just much more sensitive. So CD57 count, this is something that we sometimes measure for Lyme patients, which is a type of T-lymphocyte, which is a part of your white blood cells. It's hard to always, there's so many. The immunology is quite confusing, but just think of this as, one of the good guys, police officers, right? The natural killer cells, and then you have, let's say, SWAT teams, and those are different types of police officers. You got your traffic cops. There's different types of white blood cells. And CD57 is a very specific subset, and it can be reduced in chronic Lyme cases. Okay? And that is one way to say, is this person chronically ill with maybe something like Lyme? But it's not just specific for Lyme disease. It can show up in other infections like chlamydia, pneumonia, mycoplasma. So it's not just with Lyme, but it is important to look at this because you can see here, normally we want our CD57 count to be above 130. Lyme patients, well, they can be below 130. I've seen it down in the teens, and that's not good. We want to make that even better. The EliSpot test is, super, super sensitive, 100 times more sensitive than antibody testing. And it looks for reactivity of your T cells. Okay, so if your T cells are getting activated because they're meeting up with the bacteria or virus that they are having to fight, they put out this interferon gamma. It's a cytokine. Okay, it's a way of measuring it. And so, let's say, they also think, again, this is really technical stuff, but imagine if I got my bowl of T cells here, all right, my little petri dish of T cells, and I sprinkle on top of it some Lyme cell walls, okay, some spirochete from Borrelia burgdorferi, or let's say we want to do it for Bartonella, or a virus like Epstein-Barr or others. We sprinkle it on top of the petri dish filled with your white blood cells, and some of those CD57 cells, And if they are currently dealing with the infection in your body, they're going to start putting out interferon gamma. And we can see that because we tag that, and we can look at it. And let's see here. Oh, there it is. See that? That looks like some little spots, EliSpot, okay? And that, depending on how many spots and how strong it is, can tell you how strong your immune system is currently activating that infection. So it's pretty important test because it can show active infection. Remember I said IgG, IgM, it gets a little confusing. Is it an active infection? Is it not? There's other aspects to it. This is pretty sophisticated, 100 times more sensitive than the antibody testing. And it can tell you how strong the infection is, which is really important because 4 to 6 weeks after if your treatment is good, that should start going down and then disappear. And then maybe that really means that the person isn't infected, or they may still show some antibodies. It's a little different. And there's a lot of symptoms with Lyme disease. It could be a lot of different, infections. People are not just infected with Borrelia. People are infected with things like chlamydia pneumoniae, mycoplasma, Bartonella, Ehrlichia, Rickettsia. You can see the names here. And it can cause a lot of symptoms, some of them overlapping. Some of them are very unique. So what kind of co-infections can we have? Things like Babesia, it's more of a parasitic organism. And night sweats, and these are one of the things that can happen. Bartonella, this can cause a lot of neurological problems, a lot of psychiatric problems. And this can also cause, by the way, if you see this in anybody, see that? Look at that. That's a patient of mine. Looks like stretch marks, doesn't it? Kind of running over here. This person's not fat. It's not like they lost a lot of weight. People say, oh, they're growing, and, it was just stretch marks from growing too fast. And no, that is actually a Bartonella marking, and they've done biopsies of these and have seen that there's Bartonella kind of burrowing there under the skin. So this is a sign of having Bartonella, also known as cat scratch fever, because it can be transmitted by cats, Bartonella, and maybe it's because also these look like they were scratched. Ehrlichia, Anaplasma, Chlamydia, Coxiella, Rickettsia, and many viruses. Epstein-Barr virus. People constantly are coming in with these viruses, and in some ways this can be more of a problem than some of the bacteria themselves because it gets overlooked a lot, okay? And people even had old infections with herpes viruses, Epstein-Barr viruses. If they get sick with Lyme, it's like they come back out of hiding and start reactivating in the system. Again, on Western Blot, they will show up as, guess what? Oh, you had an old infection. Oh, IgG, it's like, really high, but that was from before when you had, mono or something when you were a kid or something. No, because then we run an EliSpot test and we see that their levels are strong. Their immune system is pumping out interferon gamma because it's currently dealing with the infection. It's not just an old case. It's an active infection. And that happens. We see that often. Quickly, we'll go over a little bit about treatments. We have things like the tetracyclines, like doxycycline is one of the main ones are used for Borrelia infections, for Lyme disease. Penicillins like amoxicillin is used, and more in kids. Kids usually can't use the tetracyclines. You have cephalosporins like Rocephin and stuff used for more of these neurological cases, getting across the blood-brain barrier really well. You'll even use IV cases, macrolides. You can see them here. Some of the more things like Babesia and others, they'll be using things like Mepron, or there's sometimes they call them cystbusters like tenidazole. Okay, these are all other types of antiparasitics. So this is what the conventional uses for Lyme, how they may treat them. But there's a big controversy, right? So it's not just a diagnosis. We just talked about problems with diagnoses, but what about just treating them? Okay, treating people for a long period of time. What do you treat them? The standard is 3 weeks. Okay, 3 weeks of antibiotic therapy. Is that long enough? Or maybe they need to go longer. Some people are on antibiotics for years and years. That can cause a problem with the gut microbiome, possibly. And then the bacteria change form. They're pleomorphic. We think, oh, it just always looks like that nice, like corkscrew. It doesn't happen that way. They actually morph into different types of organisms, which is different looking organisms, so I say, these cyst forms, these L forms, and finally biofilms to evade the immune system and even the antibiotics. So take a look at this. So we have here, that is a Lyme biofilm. So what's a biofilm? Well, just think of it as like a city, a walled off city to hide in if something goes wrong, and also just ways of improving communication. All right, this maybe you wake up in the morning, you know how your teeth feel like a little gritty, they have like a film on it. That's a bacterial biofilm. Okay, that's something that occurs all the time with bacteria. Okay, biofilms are a naturally occurring thing. The bacteria are coming together, they're pooling resources. I mean, these things are sophisticated. These are like almost like its own organism in itself. It's got, sewage systems. It's pretty amazing. But it allows them to communicate better. It allows them to exchange genetic information, etc., etc. But I want you to see this next one. That is the same type of biofilm. I'd like to go back one more time. You're saying, what is this? You see down there all those like little lines? Those are individual Borrelia spirochetes. And here is like millions of them. Now, if we bomb it with something like an antibiotic, boom, look at this. See, no more spirochetes out here. But guess what's going on inside the city? They're doing just fine. I kind of liken it to, if everyone's ever been to in college, some of these people are, having a college frat party. Police come, everyone runs inside, and no one can get caught there. And when everything's gone, they come out, and the party continues. Same kind of thing with the antibiotics. The party can continue when the antibiotics perhaps are gone. So we have to be able to break up these biofilms. So finally, next time, we're going to talk a little bit about the whole body approach. So I really hope you join us for next time, because again, we're going to get into more information about how we can start treating these cases. Before we go, there was a few questions that were posed to me. Lee had asked, can the spirochetes, the Lyme spirochete, be passed from mother to baby in the womb? And the answer is yes. And it's actually, kind of scary, but it can. Babies can be born with Lyme disease, and that's not a great thing. And they can always be symptomatic, and they never know what it's like not to feel good, because they were kind of born that way. I also had Sarah had asked the question is, how do we protect ourselves from the ticks? And I think that's a great question. And I'm actually going to hopefully dedicate a particular web broadcast just to how you perhaps take care of yourself, and what things to use topically, but also what about your lawns, right? Your kids are going out to play outside. I mean, we shouldn't have to live always in fear about these things. So that's really important. Anyhow, I really appreciate you all coming here and watching this web broadcast. Leave your questions, comments on the Facebook page. There's also, should be broadcasting to YouTube as well, or YouTube channels, so you can post questions and comments there. And, until next time, I'm Dr. Adam Breiner, and have a wonderful day.